politicians say doctors made those choices. I don't think so. I think it was like politics.
Yeah?
And like how politics think is bigger numbers.
Yet this doctor says that this response wasn't informed by the healthcare system at all.
Because the kids are devastated.
They are absolutely. And everyone knows it. Like in a healthcare system, everyone knows it.
Tamara Ugolini here with Rebel News, bringing you more reports from the World Health Summit 2022 that takes place yearly in Berlin, Germany. It's a 3-day globalist conference that is now done in partnership with the World Health Organization, where health professionals and bureaucrats gather to rub shoulders with the elites pushing the global health agenda forward.
The theme of this year's World Health Summit is taking global health to a new level.
It's sponsored heavily by the pharmaceutical lobby and its corporate consultants who appear to have special interests in manufacturing global health outcomes. We were on the scene for the full 3 days to get an insider's glimpse into this conference to see what exactly was being discussed when the cameras were off and what people within the health sector truly thought of the COVID-19 response. In the clips that I'm about to show you, a local Berlin ICU doctor shares his thoughts with my colleague Alexa Lavoie and myself. As always, these reports are only made possible through your generous support and donations at rebelwho.com. At that special website, you can also search all of our previous reports, and there you can stay up to date with the reports as we continue to publish them. Here is that ICU doctor admitting that he knew the public health response would and has harmed the general public, and especially our most prized future, the children.
Because the kids are devastated.
They are absolutely. And everyone knows it. Like in a healthcare system, everyone knows it.
Yeah?
Like the governmental choices didn't come out of the healthcare system, at least in Germany, not. I know.
So everyone in the healthcare system apparently knows how the public health response has devastated children, but what are they doing about it?
I'm going to be very frank. There's no politician in this country who's going to disagree with their chief medical officer. They just aren't going to do it. They might as well throw a rope around their neck and jump off a bridge. They're done.
I thought that the government was continually listening to the experts and trusting them. At least that's what we are told here in Canada. Yet this doctor says that this response wasn't informed by the healthcare system at all. Listen to him elaborate on this.
Politicians say doctors made those choices. I don't think so. I think it was like politics.
Yeah?
And like how politics think is bigger numbers. Of course. Like they need to think for everyone.
They extrapolate.
Yeah, and they think like in terms of law and like they make the laws. So they
policy.
think in terms of policy of like more like Kant.
Yeah.
Like the bigger laws everyone should be ruled by. And of course then they in a politician way of thinking about reality, a lockdown is perfect. Absolutely makes sense. Mm-hmm. Absolutely. If you look at the data, it makes sense. As a doctor, you always need to. But now I think, like to be honest, we need a recovery plan for children. Everything else, the number one thing we need to do is recover the children because they will also be like they are at the moment sick from the things, but they will also be like the grown-ups of the future.
Yeah.
So it's like you get two things at the price of one. You make people healthy, and you make future people healthy because you help the children.
The children, yeah.
And they need a serious recovery, and we talk way too less about it. So when the lockdowns came, they were excluded of the system.
Fully.
Exactly. Now, at least when we do the recovery plan, which I think we need for children, we should include them into finding solutions for them.
There's no talk here about recovery, though.
No.
Or anything about a review.
I was a bit disappointed for that.
Yeah.
Did you hear him say sick from the things?
Sick from the things?
He's insinuating that those miraculous injections and those novel drugs are responsible for it. But he agrees that it's disappointing there is no discussion about any sort of harms implemented by the COVID-19 response at this particular conference, that none of the wrongdoings are being discussed, and how can we even begin to recover from the far-reaching and implicating damage caused by lockdowns, indiscriminate masking, and coercive vaccine mandates as a whole in society, but especially how can we focus this recovery on what it's done to the children. The Irish Parliament recently heard from one of their policy advisors, Fiona Jennings, that children are still suffering COVID-related anxieties. The article says that parents were reporting children's anxieties about parents being safe constantly, social anxiety and health anxiety arising from the COVID message of keep safe and don't make others sick. She said there were also issues around obsessive compulsive behavior, such as excessive hand washing and use of sanitizers. Medical professionals know, and arguably knew from the onset, that this response was devastating an entire generation of impressionable children, and it's disgustingly shameful that many continue to stay silent as the future of our societal fabric hangs in the balance, while the ones that speak out are silenced, slandered, and fired. For Rebel News, I'm Tamara Ugolini. All of the reports from the World Health Summit 2022 can be found at rebelwho.com. If you're in a position to do so, you can also chip in to help offset the costs of this extensive coverage. Again, everything can be found at rebelwho.com. We appreciate your support and look forward to bringing you more reports.